Thank you, Chair. Thank you all for being here today. I will start with you, Dr. Kumanan, related to our healthcare system. And you said, and I quote, "We're running out of time and more needs to be done," end quote. And, firstly, I'd say that applies to a lot of the things we're hearing both today and other days at these hearings related to the environment, childcare, housing. We need to make sure that the government is listening and taking action quickly to address these crises. There's crises in virtually every file. So, for example, you said freeing up 20 to 30% of the admin burden could add 3.8 million appointments. And with 2.3 million Ontarians not having a family doctor, that could probably cover at least half of them, right? Something to that effect. So I just want to ask if you know what the barriers are to getting those things done. Do you see any movement?
Yeah, that's a great question. Thank you. I'll start by saying, so we are spending over 19 hours per week, and that actually makes up about 40% of our work week. So really, when we're looking at increasing capacity in family medicine, I think the administrative burden is a key area to address. And I will just touch on, you commented that you're hearing from a lot of people today, and certainly I'm sure you're hearing from a lot of important voices. I will say when we look at family medicine, we have so much evidence to support investments in primary care. And I know our whole healthcare system is struggling right now. Investing in primary care will allow us to help support hospitals, long-term care. We see very clearly from our data, and we see this across the world in the strongest healthcare systems, when there is high attachment of patients to family physicians, we see reduced costs overall to the system because we know it's a much more cost-effective way of running healthcare. We see improved patient outcomes, reduced rates of emergency room visits, reduced rates of hospitalization, and patients live longer. So it definitely is the right way to go.